Good morning. My name is Cheryl Smithgall. I'm a research fellow at Chapin Hall at the University of Chicago. I'd like to welcome you here this morning on behalf of Chapin Hall and the Urban Institute. This is one of our programs in the 2010-2011 series of our Thursday's Child Public Policy Forum. We'd like to thank those of you who are here in person and also our audience who is joining us by webcast today. Today's program is entitled Preventing Youth Violence in Communities, What Does the Evidence Tell Us? We trust that you'll find today's conversation lively and informative. I'll be introducing our panel of experts on this topic today. Following the introductions, each panelist will speak for about 15 to 20 minutes, and then we'd like to invite questions from the audience. Our first panelist this morning is Thomas Simon. He's the Deputy Associate Director for Science within the Division of Violence Prevention in the National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention. He's worked for the Division of Violence Prevention for the past 15 years and has published extensively on topics of youth violence and suicide prevention. Dr. Simon has served as a scientific advisor on multiple etiologic studies examining risk and protective factors for aggressive and suicidal behavior and longitudinal evaluations of violence and suicide prevention programs. Our second panelist this morning is Deborah Gorman-Smith. She's a research fellow at Chapin Hall and principal investigator and director of the Chicago Center for Youth Violence Prevention, one of 4 national academic centers of excellence funded by the Center for Disease Control and Prevention. Her program of research, grounded in a public health perspective, is focused on advancing knowledge about development, risk, and prevention of aggression and violence, with specific focus on minority youth living in poor urban settings. Dr. Gorman-Smith has published extensively in areas related to youth violence, examining the relationship between community characteristics, family functioning, and aggression and violence, including partner violence and the impact of family-focused preventive interventions. Our third panelist this morning is Barbee-Dixon. She's with the Habilitative Systems Incorporated, where she currently serves as the Chief Operating Officer. HSI is a human service organization located on Chicago's west side that provides a comprehensive program of services serving individuals and families across the life cycle, from infancy through senior living. As COO, Dr. Dixon is responsible for day-to-day administrative and programmatic operations, systems enhancement, quality improvement, and oversees the organization's various research and education activities. Prior to her current role, Dr. Barbee-Dixon served as Deputy Executive Director for HSI's Program Operations and Division Director for the agency's Prevention, Education, and Child Care Services. Dr. Barbee-Dixon received her Ed.D. in Educational Psychology from Northern Illinois University and completed 2-year postdoc fellowship at the Institute for Juvenile Research in the Department of Psychiatry at the University of Illinois at Chicago. Much of her time was devoted to working in the Disruptive Behavior Disorders Clinic, assisting in developing, delivering, and evaluating state-of-the-art mental health interventions for children and families with externalizing disorders and comorbid problems. Dr. Barbee-Dixon currently serves as a surveyor for the Commission on the Accreditation of Rehabilitation Facilities, reviewing organizational child, youth, and behavioral health standards for organizations across the United States. She serves as an advisory board member for the Institute for Juvenile Research at the University of Illinois at Chicago and is a board member for Circle of Parents, a national parent network. With that, I'm going to turn it over to our first panelist, Dr. Simon.
Great. Thank you, Cheryl. And thank you all for joining us this morning. I'm very pleased to be here to have an opportunity to talk about this important topic. I really want to thank Chapin Hall for hosting us all and for choosing such an important topic and for giving me the opportunity to participate. I've structured my comments this morning around 2 central points. First, I want to elaborate on why youth violence is a critical public health problem. And second, I want to talk about why I am confident that we can address and prevent the problem of youth violence in the United States. Youth violence is often thought of as simply a crime problem, a problem to be addressed by the criminal justice system. When people think of the Centers for Disease Control and Prevention, this is often the image that people have in mind. They think of scientists in biohazard suits collecting samples in the lab or working in the deepest parts of the jungle, and rarely do they think of the CDC as an agency focused on issues like violence prevention or think about violence as a public health problem at all. But the fact is that homicide is the second leading cause of death among youth between the ages of 15 and 24 in the United States. Each year, nearly 6,000 youth are victims of homicide. That works out to be an average of 16 every day. And minority youth in the United States are disproportionately affected. In fact, among black youth, homicide is the leading cause of death, accounting for more deaths from all the other 10 leading causes of death, including suicide, car crashes, HIV, and cancer, all combined. Of course, deaths are just the tip of the iceberg when talking about the burden associated with the problem of youth violence. We know that for every homicide among young people, there's 98 youth who are treated in emergency departments for non-fatal injuries from physical assaults. And the base of this iceberg is even larger, accounting for the youth who are victims of violence but aren't treated in emergency departments. It's very difficult to understand the true prevalence of the base of this iceberg, but we know from some statistics, like the National Youth Risk Behavior Survey, that 32% actually, of high school students in the United States report having been involved in at least one physical fight in the past 12 months, and 20% report being bullied on school property. So youth violence is a critical priority, not just because of the burden in terms of injuries and deaths, but also because of the larger emotional, social, and economic consequences associated with violence. And these consequences apply to youth, their families, their schools, and to entire communities. It's very difficult to fully quantify the economic consequences associated with violence, but just to give you an idea, statistics show that approximately $7.7 billion per year are lost due to just medical costs and work loss costs associated with youth homicide. Youth homicides account for 31% of all of the homicides in the United States across all ages. This $7.7 billion estimate is really just scratching the surface because it doesn't include all the other costs associated with the criminal justice system, the care that's provided to the victims' families, as well as all the costs associated with non-fatal violence in the United States. One can see how violence can contribute to a negative cycle within communities of flight of the tax base, poor schools, lack of services, lack of jobs, etc. It's clear that law enforcement alone is not enough. We cannot wait to act and intervene only after violence occurs. CDC has developed a public health approach to violence prevention that complements what law enforcement can do. It complements law enforcement in multiple ways. First, we place our emphasis on primary prevention, that is, stopping violence before it occurs by focusing on the underlying causes. Second, we focus on strategies that can lead to community-wide changes. The idea is to work toward a population shift in risk. Third, we incorporate multiple perspectives. Youth violence is a complex problem. It can benefit from perspectives from psychology, sociology, epidemiology, etc. And we need to work across sectors, including health, justice, education, etc. We also employ a rigorous scientific approach to the work that we do. This scientific approach includes 4 steps. These are the 4 steps in the public health model. The first step is to describe the problem. Here we focus on understanding trends and the subgroups of individuals and communities that are at greatest risk. The second step is to identify the factors that increase or decrease risk so that we can use that information in the third step, which is to develop and then evaluate prevention strategies designed to modify these factors. The evaluation is critical so that we know whether these strategies actually have an impact on behavior and risk for violence. The final step then is to take all this information and to disseminate it into communities so that it can have the greatest impact. Now, through this scientific approach and these 4 steps, we've identified prevention strategies that work to prevent youth violence. So it's clear that prevention is possible. To illustrate the scientific evidence, I want to describe the Blueprints Project at the University of Colorado's Center for the Study of the Prevention of Violence. The staff at Blueprints have systematically reviewed more than 900 programs focused on youth violence. They've applied a very rigorous criteria to determine success. These criteria include a rigorous experimental or quasi-experimental design, includes having shown significant reductions or deterrent effects in violence specifically or delinquency and substance abuse more generally. And these effects have to be maintained for at least 1 year. All this is required for a program to meet the criteria of being promising. In order for a program to be considered a model program, it also has to have been replicated successfully in at least one other site. So most programs, as you can imagine, do not have anywhere near this kind of rigorous evaluation or evidence to support them. However, to date, the Blueprints program has identified 11 model and 19 promising programs that are waiting to be replicated. The model and promising programs include strategies focused on schools, focused on providing families with parenting skills, relationship skills, communication skills. They're focused on mentoring. They're focused on issues like providing intensive treatment to the highest risk youth. So there's quite a range of strategies that are included within Blueprints. One example that I wanted to mention are the universal school-based prevention approaches. This is a fairly large category of prevention strategies that are out there. Universal school-based programs are designed to teach all students in a given school or grade about violence prevention. The programs typically provide information about violence. They try to change how you think and feel about violence and provide youth with the skills they need to avoid disputes or to resolve disputes without violence. The CDC-supported Task Force for Community Preventive Services has conducted a systematic review of school-based programs, and they've concluded that these universal programs can result in a 15% relative reduction in violent behavior, and that these effects persist regardless of setting, that is, regardless of the socioeconomic status within communities or the crime rates within communities that these schools serve. And they also hold across populations, regardless of the predominant ethnicity within the schools. So this is just one example of an evidence-based strategy that's included within Blueprints. And I think the Blueprints work tells us many things about many different approaches, but I think it's particularly important to realize a couple of things. The first is the fact that they looked at 900 programs and found only 30 that met these rigorous criteria. That tells us that most programs that are out there really haven't been rigorously evaluated, and those programs that have been evaluated often don't meet these kinds of rigorous criteria. So on one hand, that's the bad news. Most of the programs that are out there really just haven't been evaluated. But the good news is, on the other hand, that there are 30 programs that have been evaluated. When these rigorous criteria are applied to them, they meet the standard. So there's some encouragement there. Now, all too often, we keep doing what we have been doing. Oftentimes, this has to do with the fact that people like existing prevention strategies within communities. They feel that they work. They have anecdotal support because the kids like them, the parents like them, the teachers like them, et cetera. And so they'll continue to implement the strategies that they have been implementing, either without data to support their evidence, or even in the face of data suggesting that they do not work. We know that there are quite a few very popular prevention strategies out there that, when evaluated, have been shown not to be effective. I'm thinking of like the scared straight types of strategies. I'm thinking of gun buyback programs. I'm thinking of strategies that transfer juvenile offenders into the adult system. Some of these strategies, when rigorously evaluated, have been shown not only not to work, but have been shown to increase risk for subsequent violence. So we need to bridge this gap between what we know from research and what's happening in practice. So the Division of Violence Prevention at CDC is supporting efforts within communities to help communities to make decisions based on the best available evidence. So we have a new initiative. It's called STRIVE, which stands for Striving to Reduce Youth Violence Everywhere. It's focused on preventing violence before it starts. It has 3 primary goals. The first is to increase awareness that youth violence can and should be prevented. The second is to promote the use of prevention approaches that are based on the best available evidence. And the third is to provide guidance to communities on how to prevent youth violence. Strive encourages a comprehensive approach. This means supporting not just individuals within communities, but also extending beyond individuals to look at prevention strategies that focus on relationship factors, community factors, or the larger societal issues that are associated with risk for violence. Now, the Strive initiative is just ramping up, but it's building momentum quickly. Let me share with you just a few key activities that are part of the Strive initiative. First, preventing youth violence requires information, training, and other resources. So the Strive Online was developed specifically to provide the essential how-to information to community decision makers to help them to strategically plan, implement, and evaluate youth violence prevention strategies. This resource provides access to the latest evidence-based information and tools. It provides training and technical assistance in very interactive ways through the website, as well as online community workspaces. The idea here is to help communities to be able to move step by step through the entire process, from planning to implementation. A second key activity within Strive is to build multi-sector collaboration. Strive Online is working to encourage and to help communities to build multi-sector collaborations that include health and human services, education, criminal justice, just to name a few sectors that are key to addressing the issue of youth violence. Strive is also building a multi-sector national partnership to support local action. We've first assembled an action council that consists of 13 national organizations, and we've been working with this core group to build a larger network of partners. We're calling it the Partnership Network. This meeting is going to kick off in March, and it's going to include 30 national organizations. The idea here is that the Partnership Network is going to play a key role in raising awareness about youth violence as a public health problem, that youth violence can be prevented. It's going to focus on providing information, training, and inspiration to other national organizations. Now, another key component of Strive is Unity, which stands for Urban Networks Increasing Thriving Youth. Unity is led by the Prevention Institute in California. It's funded by the CDC and the California Wellness Foundation. And they work with cities around the country to increase their readiness to address the problem of youth violence, to work with them to develop a plan, and to enhance their capacity to focus on youth violence prevention. Unity also works more intensively with a subgroup of cities as part of the Unity City Network, and this includes Chicago specifically. And Unity also provides tools and resources to practitioners and decision makers around the country through training and consultations. So Unity is a key resource for cities around the country, and it's a key component of the larger Strive initiative. Now, I would be remiss if I didn't mention that although we have learned a lot about youth violence prevention and the strategies that are most successful, there are some critical research gaps that remain. We recently published a research agenda for the next decade, and this includes 12 priorities that are specific to youth violence prevention. These include the need to better evaluate how we can change community and societal factors that influence risk for violence. We also need to better quantify the economic efficiency of the existing evidence-based strategies. Now, some of this work has been done already, and it's quite encouraging to see the return on the investment associated with implementing these prevention strategies. Many of them result in a very significant cost savings. And in this era of decreased budgets and strict budget limitations, it's very important to be able to show the net savings associated with implementing evidence-based prevention programs. So this is a key priority in our research agenda. We also focus on how to adapt and disseminate strategies that we know work so that more youth in more settings can benefit from them. To help address these gaps in terms of research priorities, we engage in a range of research activities, and one important example is our academic centers of excellence. We like to call these our ACEs. The ACEs focus on collaboration among researchers, non-governmental and governmental organizations, including the local health departments, as well as leaders from a defined high-risk community. The goal here is to implement comprehensive, evidence-based approaches to reduce youth violence within these defined communities. And by comprehensive, I mean they focus on individual factors, relationship factors, and community-level factors, and they study the impact of these factors on youth violence and other outcomes over time. This research is going to be critical for informing the future of the STRIVE initiative. We've recently funded 4 sites, including one right here in Chicago at Chapin Hall, being directed by our colleague Dr. Deborah Gorman-Smith, and she's going to be talking next, actually. So, in summary, youth violence is a critical public health problem with significant consequences for youth, families, and communities. And public health can complement what's happening in law enforcement in multiple ways, including our approach to how we address the problem, as well as the specific skill sets in terms of understanding surveillance, epidemiology, and evaluation research. As recognized by the U.S. Conference of Mayors, we can't arrest our way out of this problem. Prevention is the key to long-term success. We should not accept that youth violence is an inevitable part of growing up in the United States. We can also not accept statements that we don't know what to do. We have a lot of information that we can put into place to address the youth violence problem in this country. We know what to do. We know how to make changes that can actually have an effect. We need comprehensive strategies based on the best available evidence. So I just want to end by providing a couple of websites that you might find useful. The first is for the National Center for Injury Prevention and Control. Here you can access information about some of the statistics I provided, some of the programs that I mentioned, and some of the research that I described. The second website is for our funding page specifically. Here you can see information about current and past funding opportunity announcements, see some descriptions of our currently funded work, and get some tips about how to apply for funding at CDC. Thank you for your time this morning. And I'm going to turn the controls over to Deb here.
Thanks.
And we're going to take questions at the end, is my understanding.
I want to thank everyone again for taking the time to be here, both in person and for those of you who are out there on the web, to talk about this very important topic. And before I start talking about content, I want to point out that the group you see here today represents, in some small way, what I think is our best possible way forward in working to address the significant problem of youth violence in this country. Much of what we're talking about today represents work born out of a number of partnerships across the country between university-based researchers and those working in the community. In schools, community mental health agencies, the criminal justice system, et cetera. And for our own work, and I know for many others, also represents the leadership of CDC and other federal agencies and foundations in prioritizing youth violence as an issue that needs to be studied to have any hope of effectively addressing the problem both in the short and the long term. This is an area that needs to be studied, that we need research in order to really have an impact on the problem. I've been working actually as part of a larger collaboration. Pat Tolan and David and Henry and I have been working together for about 20 years. More recently, colleagues Mike Shoney and Franklin Gay, and I always point that out because they're much younger than we are, have been working together and a whole host of other people to try to solve this problem. Our work has really followed the public health model that Tom outlined in trying to look at where the problem exists within our communities, to identify risk and protective factors, to use that information to develop different types of interventions, to rigorously evaluate those, to throw out those interventions that don't look like they're actually having any effect, and for those that do, to work with our community partners to disseminate and rigorously evaluate as we move that on. I think we understand that the fact that a lot of people, including people in this room, have been working at this problem for 20 years and we haven't quite solved the problem, suggests that there's no single or simple answer to reducing youth violence. And the problem, as Tom pointed out, is multiply determined and requires coordinated efforts at multiple levels and across systems. I throw this out, this is really a shout out for my kids. A colleague, when first coming to Chapin Hall, trying to explain a little bit about her background and the work she was doing, put up this slide that was a Wordle, which I thought was really interesting, and it helped me really visually see the kind of work that she had been doing. So we took some of our most recent research studies and threw them into a Wordle, and it tells you a little bit about the kind of work that we've been doing in terms of focusing on families and neighborhoods. And I had never heard of a Wordle, but when my kids saw this, they said, "Oh, you're finally learning how to do Wordles." The second thing I want to say about the complexity of this is, actually I'll go back for a second, is that in the last 20 years, I've worked with literally hundreds of people out in the community, teachers, mental health workers, those in the juvenile justice system, DCFS, and universally, all of those individuals that I've worked with feel strongly in and are motivated by the vision of a neighborhood, community, society in which children and families are supported to achieve and have healthy and positive outcomes. We all want and believe that our actions will do good, that children will be better for them. Unfortunately, as Tom pointed out, one of the more disconcerting and frustrating parts of what I've come to understand over that time is that even programs that come from the best places in our heart, that are often based in sound theory and are often based in preliminary evidence of effects, sometimes what we do and the programs we implement are simply not effective. And worse, sometimes they actually cause harm. And the only way for us to know whether or not what we're doing has any impact is if we rigorously evaluate it. Now, not everything can be or is ready to be evaluated, and I recognize the complexity of that statement. But ultimately, particularly if we're talking about moving programs out to scale and if we have programs that are being used across communities and across the country, we really need to be ready to hold the program and hold ourselves up to that evaluation. And again, not just because we may not be doing any good, but because we may actually be doing some harm. So this is not only true in violence prevention, but it's true in medicine and in a number of other areas. So I just want to point out just a couple of illustrative examples in medicine that have commonly held practices based in clinical experience and sometimes even in preliminary evidence have been overturned by well-implemented randomized controlled trials. So hormone replacement therapy for postmenopausal women actually increases stroke and heart disease. Stents to open clogged arteries shown no better than drugs for most heart patients. Beta blockers, having babies sleep on their stomachs. We all know these examples that when the evidence came back, we made a decision, physicians made a decision to change their behavior. We have a similar pattern of programs in other areas of social policy, the Department of Labor's New Chance program, demonstration program, no evidence of effects on a host of outcomes, educational attainment, work, et cetera, Even Start Family Literacy Program, 21st century community learning centers, which were after-school activities in high-poverty schools. We know that after-school programs can be very effective in helping reduce violence, but what we learned from this evaluation is that there are certain requisite components of those interventions that matter. It's not just enough to open up a room and have children come in and just have a space for them after school. And then in violence prevention, and I won't go into these, Tom mentioned these as well too, approaches that of evidence that are not effective, and actually some of these have been shown in more than several trials to actually increase risk for some. Scared Straight, boot camps, DARE, individual insight-oriented therapy for high-risk youth, and working with small groups of high-risk youth together all have been shown to be either ineffective or actually increase risk. So this can feel overwhelming and a bit depressing. And I actually have 6 or 7 more slides of examples of these programs that I won't show. But as Tom said, the good news is that in the area of youth violence prevention, actually more than in any other area of social policy or behavior problems, we do have a number of programs that have been identified as having an impact and have been shown to reduce youth violence. So I'm going to talk a little bit about the kinds of programs and the key components of those interventions, and a bit about what this might really look like on the ground. And Karen then is going to talk a little bit more about moving evidence-based programs into the community and the intensive on-the-ground and behind-the-scenes work that it takes to do that. So in an ideal world, what would we have, or even in a close to ideal world? What would a comprehensive and coordinated system look like? There would be a coordinated set of programs based in the best available evidence. It would combine programs that are intended to be universal, so those who are delivered to supporting the whole population, like the school-based interventions the universal school-based interventions that Tom talked about earlier, community-level programs to support all parents and families. There would be programs directed toward targeted or selected high-risk groups. So we need programs that support all kids and families, but we know that within a given population that there are varying levels of risk, so we need targeted programs that are specific to the needs of those populations. It should span across development, programs that start when mothers, particularly high-risk mothers, are pregnant, and then go across the period of development. And as Tom said, that would address risk and protective factors across multiple systems. So what do we know about patterns, risk, and prevention? I won't talk about the numbers in the same way that Tom did, but epidemiologically, we know that the problem of youth violence cuts across gender. I suspect that when I talk to most audiences, the image they have of the individual who's committing youth violence is typically male. But we know that this is one of the areas where girls are trying to catch up, apparently. It cuts across age groups, socioeconomic levels, racial and ethnic groups. So it's a problem in every community. Starting earlier is related to greater and longer involvement, which is why our focus on prevention. It's present in the general population, but the highest levels of violence and the most severe violence are concentrated in a small portion of youth. The general numbers that are understood to be out there, but 6% of the population accounts for 2/3 of the violence. Our data and other recent data suggests that there's also appears to be a small group who become very seriously involved in violence. During adolescence, they may look a lot like nonviolent kids until they reach adolescence, and then they quickly escalate to serious and chronic involvement. And those kids look different than those kids who are involved in more serious kinds of behavior much longer over their life course, and trying to understand. And those kids are harder to catch early on. And may represent some sort of temporary involvement in gangs, at least in urban neighborhoods. And then we also know that violence is concentrated in high poverty, low resourced communities. This may look familiar. This is our developmental ecological model. Again, we would attempt to address risk and protective factors across these different levels of system. I think what this model doesn't well represent is the fact that while there are direct effects of each of these levels of system, family, peer, school, neighborhood, the other piece that's important is the interaction between those systems. A lot of our own work is focused on helping families who live within different kinds of neighborhood contexts. So the interaction between families and neighborhoods, that the same kind of parenting, the same actions may have a different relation to kids' outcome if you live in a different kind of neighborhood. And what it takes to parent and raise kids in some neighborhoods is very different than in other neighborhoods, and that we need to think about those different kinds of contexts when we're putting together interventions. And then the other thing that this does not well represent is the fact that this really is different across development, that the effects of a neighborhood on a kid is different when he's an adolescent and spending much more time out in the neighborhood than it is when they're a young child, when much of the effect of the neighborhood may be through the effect on parents. So we need to think about the way these different developmental systems impact both risk and intervention across development. So that's essentially the same thing. So what do we know? I'm quickly going to go through risk factors. I would encourage you to the CDC website, and the Strive website really has a tremendous number of resources and details, a lot of the research on risk and protective factors, but quickly. So what do we know about individual risk as related to violence, early aggression, hyperactivity, impulse control problems, kids who are oppositionally defiant, risk-taking behaviors, particularly early in development. So interventions need to be thinking about addressing these individual factors. Family factors, those that are somewhat harder to change by the time we're starting to interact with people, but relate to parenting behaviors, so a parental history of criminal or antisocial behavior, becoming a parent early, having a lot of family transitions. Family factors that are somewhat easier to change, and I say somewhat easier to change because all of us who have worked with kids and families, or anyone, knows that it's not so easy to change people's behavior. But we know that no matter where you live, supervision and monitoring is critical to impacting risk. It's important to know where your kids are, know who their friends are, know the parents of their friends. Inconsistent and harsh discipline, low levels of emotional warmth. And I highlight this because in our data, cohesion, connection, warmth seems particularly important as related to risk for violence. And I don't mean warmth in the, you need to hug your kid every day, though I would encourage people to hug their kid every day. But really it's about knowing that you can count on someone and feeling connected to someone. And it seems particularly important in urban neighborhoods, and most parenting programs focus on the skills of parenting and don't necessarily address these other aspects of family functioning. hostility, parental conflict, kinds of things that we would all assume. Peer factors, having delinquent friends, delinquent siblings, gang membership, high rates of going to schools in which there are high rates of delinquency and violence, and also schools and classrooms with norms supporting the use of aggression and violence. Neighborhood factors, urban inner city residents, areas of concentrated poverty, high rates of crime. And one of the things that Tom pointed out in his talk as well is one of the things that we know is that the social organization, the social connection within neighborhoods is also important. And that anyone who lives in Chicago can probably give examples of two neighborhoods who look very similar in terms of levels of poverty and levels of crime, but the social organization of the neighborhood is very different. And social organization appears to be one of those factors that can be protective, can be a buffer for kids for risk. So I think that's part of why CDC has in its research priorities identified trying to evaluate programs at the community level that can help have an impact on what's going on between neighbors. So what do we know about effective interventions? So again, this is just an example pulling from essentially the blueprints programs of what are either models or promising interventions. So we would have universal programs that talk about education and school-family partnership. Parents and families are often left out of the programs that schools provide, and we need to think about including parents and families in a different way. I think when we talk about families, it can feel overwhelming because we imagine that we have to work with each family at a time. And we need to think about creative ways to engage parents and families and a delivery system that includes parents and families. Quality after-school programming, interventions, early interventions focused on high-risk youth, like home visitation programs, family-focused interventions. Our interventions focus on working with families in multiple group settings, in part because the goal is to build those informal networks of social support within neighborhoods and to hope that that spreads across to try to build that kind of neighborhood social organization. Parent training. And then for those youth, it's much easier, not much easier, but it's easier to prevent violence before it happens, but it doesn't mean that once kids get involved that we lose all hope for them. So there are programs that show evidence of effects even for those kids who have become seriously involved. Those have to be much more intensive programs. They tend to be multidimensional and multi-component and tend to be family-focused kinds of programs. And then lastly, we obviously need to have policy and infrastructure to be able to sustain these programs, and we need to evaluate the impact of different kinds of policies. Karen is going to talk a little bit more about this, but I just want to say a couple of things about what we know from research that is required when trying to move evidence-based programs out into the community. As hard as it can be, we know from rigorous evaluations that we need to apply interventions as they were designed and as they were tested and developed. The sure way to make sure that you won't have effects of an evidence-based program is to make it different than the program it was originally. And that doesn't mean that there aren't ways that we might be able to adapt programs to have them be related to the community, but we need to study that adaptation, and we can't assume that we have to adapt. It turns out that some programs work across populations, and we actually don't need to adapt them to make them more effective. We need to apply the intervention within a system that will sustain the intervention over time. Often these programs come in and out without any infrastructure to support them and without any plan to keep them going. We need to apply it with a focus on the appropriate population. We need system support to make it be effective. I think unfortunately what happens a lot of time is money comes in, money from the state, money from the government, and we are compelled to try to get something going and get it out the door. And so there isn't enough time to do the groundwork to actually work to the point where you can have an effective program. You need appropriate training, you need ongoing supervision and support, shared goals among the collaborating systems, sustain over time, and we need to constantly evaluate both functioning and the outcome. Potential pitfalls to moving these things out: one approach fits all, that we create policy and practice formed based on these dramatic examples, and you see it happen all the time. There's an event, and people feel like they need to do something very different. And suddenly policies and practices are changed based on one event without always bringing in all of what we know about what works and what doesn't work. Again, the idea that anything that sounds like a good idea is. And once programs are set up, they'll operate as they're planned without close monitoring and ongoing technical assistance. And lastly, I'm going to put up just a couple of resources regarding evidence of impact for social interventions. These are other websites that you might go to. Again, the Blueprints for Violence Prevention is focused very specifically on violence prevention. There's also a Social Programs That Works website that is put up by the Coalition for Evidence-Based Policy. The nice thing about this website is that it provides information both about programs that have been shown to be effective and also those that have been shown to not be effective. And the Washington State Institute for Public Policy provides information on cost-benefit analysis, some of the work that Tom talked about earlier. Thank you. I'm going to turn it over to Karen.
Good morning to all of you. I'd like to start by saying thank you to Chapin Hall and in particular to Dr. Gorman-Smith for the invitation to be here as a part of this panelist on this morning. As I've sat here over the last few minutes and listened to the other presenters, it's a natural evolution in this discussion on violence prevention that I bring your perspective from the provider. As one of the members of the staff of Habilitative Systems Incorporated on the west side of Chicago, I'm here to tell you that we're an organization that really has embraced the notion of community-based research and the importance of any prevention work working with the academic institutions to be able to talk about how effective we are in the delivery of those services. Our central offices are located at 415 South Kilpatrick, and I'm bringing you just an idea of the organization's position in the community and some of our goals and objectives and what we endeavor to do, being in the heart of a community that is highly impoverished. Just to give you a bit of a sense for some of the prevalence of violence, particularly in the communities that we serve, in 2009, the 11th district, which includes West Garfield Park and most of East Garfield Park, portions of Austin, where our central offices are located, and the near west side, North Lawndale, there were recorded 55 murders. It was the highest one-year total for any district in the city since the 11th district tallied 57 murders in 2003. The murder rate for the districts in general, for those particular districts of the 11th and the 15th, you will notice that 55 murders per 100 residents. This was higher than 51 per 100,000 recorded for New Orleans, and New Orleans was the nation's leader. And then an estimated 65,970 juveniles, 16 years or younger, were arrested, 155,166 times from 1999 to 2003 in the city of Chicago, and particularly again in the 11th district where we're located. In looking at some of the trend reports relative to violence, particularly with juveniles, what was noted is that there are four most common locations that juveniles are arrested: in the public way, in educational properties or on educational properties, residential properties, and in retail sales or services. And this made up for about 88% or more of the juvenile arrests noted in the area. So that kind of gives you just a feel for what we're faced with as a provider in terms of the community at large and some of the issues relative to violence, and trying to impart the importance of looking at prevention on the front end and working together as a community and all of the stakeholders to really impact upon this as a condition. Since 1985, the organization has operated a multitude of programs relative to prevention. But what I really want to emphasize with you today is how we have noted over time the need to move to a different type of approach in providing those prevention services, particularly in line with what has been stated earlier, to use more of a system of care model or public health model in the implementation and working with our community partners, and also emphasizing the need to see the parent in the family or the parents in the family as shared leaders in the process. Our early programs of prevention focused mostly on problem behavior in the youth, although we recognized over time that there was an increasing effort to focus on promoting their social, emotional, behavioral, and cognitive development to help prevent these problem behaviors relative to violence. We also have, as an organization, embraced the paradigm shift, where both services and policies have been expanded over the last 3 decades, and our approach has shifted to supporting youth before the problems occur and the contributing circumstances. So therein lies the model: our families, working with our families, working with the schools, working with the communities and their peer groups. For our services, our prevention services relative to violence prevention, we're hoping, we've tried to impart the goals of offering innovative approaches and activities that can be used to facilitate learning in risk and at-risk children and youth, to share resources that promote positive opportunities for the child and the youth family as a unit, to provide essential strategies that will facilitate family participation, educational and community activities, and essential strategies relative to peers and mentoring services necessary to promote improved discipline. Our approach to prevention really is more of a hybrid model. Dr. Gorman-Smith spoke about the need to look at the systems and the surrounding things that impact upon the child's behavior or the youth's behavior, but also we utilize what we call our positive youth development approach. So in this particular approach, there's an emphasis on the provision of services and opportunities that will build upon a sense of competence, a sense of usefulness, a sense of belonging, and a sense of power. The way this particular model that we're using in our programs is used and how it's working is to maximize the benefits of the positive youth development, involvement of the entire communities, including young people. They are all involved in creating a continuum of services and opportunities that youth need to grow into healthy adults. Now, one of the things that we learned early on as we moved towards more of a universal prevention model is that we were trying to focus on bringing the services to the environment where we would strengthen the likelihood that all the community stakeholders, the children involved and their families would be active participants. So currently we are working in the area schools in the Austin area, and we are providing the services there on site. One of the fundamental assumptions that we have as a provider in the model of services that we're using relative to violence prevention is we're making sure that we're enduring positive results in a youth's life after they are most effectively achieved by attending to the basic needs for guidance, for support, and involvement, and not by surgical interventions. Now, this is a statement, a fundamental assumption that came out of the public-private ventures correspondence and publication back in 2000. We recognize that in our system of care that we're developing in the Austin area, that the universal prevention services that we're providing via trainings, educational forums for all the primary stakeholders, the children and the families and the school administrators, is the primary emphasis of our approach. However, the early intervention services that we're providing also includes an opportunity for us to teach skills and provide psychoeducational groups for parents and their children, and we're talking using a multi-family group model. And we'll talk a little bit about what Dr. Gorman-Smith mentioned earlier about one of those models that we've used over time. And then, of course, for children and youth that are more diagnosed and recognizing the need for therapeutic intervention, there are services that are designed to provide individual and family therapy for children who are exhibiting behavioral, emotional, and psychological problems. Here's what we've determined as a provider to be some of the missing links. Prevention strategies detailed in scientific studies rarely find their way to community agencies. So, as mentioned earlier, the importance of really being able to take the evidence-based type of services relative to prevention and really trickle those down to the community level is of great importance. Groups and interventions shown efficacious under laboratory-style conditions in academic settings yield disappointing results in community-based trials. This was a study that was done early on by Hopewood and Trickett back in 1999 and was recognized as something that was continually missing from the opportunity to make this transition. Agencies and groups and communities hardest hit by target youth with innovative programs. So we're talking about really significant at-risk issues with our youth that we're serving in the Austin area, and that in fact that they tend to be the population that is targeted for these interventions, but not necessarily looking at what it will take to be able to engage the families in providing those services. As an organization, again, we recognized early on the need for strategic partnerships. And we also saw it as a gap in between academic and community leadership in terms of the delivery of services relative to prevention. And some of that has already been substantiated by our previous presenters. In our efforts to connect with the academic institutions, and we've been a partner now on the West Side for well over 10 years, we recognize that there was one thing that we had in common, and that there was a shared belief. And the shared beliefs primarily were around that we felt that we needed a scientific focus, that can be integrated into our community-related programs. And the merger is a valuable tool for field prevention research. So, in other words, what we're saying is that we recognize that we were doing good work in our minds, but that wasn't good enough. That particularly in this time when the environment is what it is and the funding is competitive, that as organizations, it's important that we really be able to talk about the true cause behind the effect of the services that we're providing, and really being able to say that we're providing services that can be truly evaluated, and those evaluations result in the same confirmation. Some time ago, we were involved in transitioning a couple of evidence-based programs through research collaborations. Dr. Gorman-Smith and her colleagues, as well as some other researchers that we've worked with over the years. We worked to try to transition some of the approaches that are being used and that have been studied over time on the west side of Chicago in the schools. We recognize as a partner, because of our longevity of providing prevention work in the schools, that we served as a valuable tool for the researchers in kind of making the connections and actually getting into those programs to even be given consideration and for accepting the use of a particular model. In doing that transition, though, there were a number of lessons learned. General superficial understanding of transfer ideas. Additional clarity was needed regarding nuts and bolts of transferring the services. And there was a different views on how the skills and knowledge would be actually used in the community. Some of the other lessons that we learned in providing those evidence-based programs or models in our prevention work was that there was a need to consider a better match between collaborative and corporate organizational philosophies. There needed to be increased training to enhance role reversal and role performance, and that was also noted earlier, I believe, by Dr. Gorman-Smith. And to be able to distinguish research versus the ongoing implementation activities for the prevention work. There was also a need to recognize the need for mentorship and coaching, which is very, very key to the transfer process. The primary context of transfer, learning by doing via replication, and mentoring phases, all of those phases being included as part of that mentoring process. As we go forward in our partnerships with the researchers in our work relative to prevention, violence prevention in particular on the west side of Chicago, we're hopeful that there would be an ongoing examination of the perceived differences between the ideals and the practicalities of transferring evidence-based practices to the community. There's an improved mentorship and coaching in the initial project phase, the identification of transfer mechanisms and skills, process for handling any critical incidents that occur along the way. Consistent audits of the transfer, so we're talking about a process evaluation to really determine whether or not the transition is actually taking place as it was originally conceptualized, and if not, recognizing the barriers and being able to overcome those barriers. And just an increased training, the increased training process for staff overall involved in the implementation of that particular evidence-based model. And again, as an organization, we recognize that when you're talking about impacting the lives of children who have violence all around them, that it's important that community-based organizations like ours and others, that we consider and continue to consider the importance of university collaboration. This is time intensive, that has been noted before. but this usually results in a high level of engagement by all the participants involved in the particular intervention or prevention strategy. It offers a compelling prevention program development opportunity and a better understanding for the community stakeholders, for organizations as a whole, and for families about the understanding of science. Overall, when we talk about prevention work, when we talk about collaborations, when we talk about using a public health model as it relates to violence prevention, that we want to make sure that it's a model that is all-encompassing, that we recognize that the key in implementing the model is that we're making sure that we have grounded as our principles that youth must have ongoing access to developmental opportunities, that they're exposed to reliable information about behaviors that put them at risk, and then finally, that there is actually the full implementation and understanding of the prevention work and the intervention that's necessary to move our children forward.
I want to thank our panelists this morning. I think there's just an incredible breadth and depth of experience represented here. I want to thank you for sharing your thoughts with us, and we want to open up the conversation to some questions. We have a couple people who are roaming about the room with some microphones, so if you can just kind of signal them if you have a question you'd like to ask of the panel. Give us just a minute to get the microphones to those with the questions.
It was a great presentation. Thank you very much. My colleague and I work at an organization in Chicago called UCAN, Children's Advantage Network. So we spend a lot of time thinking and doing work around violence prevention. My question is really three-pronged. One, when I think of violence and the numbers, the alarming numbers that you report in the 11th District, I don't hear enough about gun control. I mean, homicide is, I don't see it in the dialogue, and I'm wondering why. My second prong to this question is, I'm the Chief Development Officer, so I'm always out there trying to figure out how to raise money and awareness. What I find interesting nationally in this crisis of violence is that there are still so many people, my friends included in the city of Chicago, who don't seem to understand that this is all happening in their neighborhoods. It's somehow there's an apathy, or and I don't want to say ignorance, but that does come to mind, that you're more worried if you go to Mexico, and aren't you afraid to travel to Mexico because you might get killed, when you can walk down the street and it's everywhere. So I'm curious, in the work that you do, if you have any advice or ways, or have been thinking about how to communicate, how to make this public awareness really tap into what I feel must be an emotional tug if we're really going to make a dent here. And then my third prong and final question is specifically to Karen, with your work with HSI and the work you do with the positive youth development. How have you been able to measure that success? Because we have to write grants and think about that. So there you go.
Quite a few questions. Do we want to start with Karen, since that one was most direct? Do you want to start with the third one about measuring success?
Yeah, exactly. Again, one of the reasons why we've aligned our partnerships with the researchers in the local university in our area was to really be in a position to help them help us evaluate our effectiveness. And as an organization for some time, we have looked at outcomes. We have studied, how the impact that we're having from both the qualitative standpoint, and then the science side of it came directly, quantitative side of it came directly through our affiliations. So it's important to us that we know that we're doing good work. As I mentioned earlier, it's not about us saying, yes, we're having good outcomes with our families, but really being able to say we're having these good outcomes because we're using this particular evidence-based model that has already been tried true and is now being replicated, and replicated exactly the way it is designed. And that is what is really promoting our effectiveness in our services. So it's been through our university partnerships that we've been evaluating our services in a much more systematic manner over time.
Why don't I take I don't know if this is back on, the gun question, and then I think the public awareness question is really important, and that might be something that Tom can talk about, because I think that's certainly a part of the intention of Strive, in part, among other things. So we absolutely can't talk about youth violence in this country without talking about guns, though we just did, to some extent. And it's complicated to talk about guns in this country. But I think what everyone can agree about, and I think what the research is clear, is that we need to keep guns out of the hands of kids, that by youth not limiting access to guns from youth will decrease certainly the lethality of the kind of violence that's going on. That we'll see a dramatic change in homicides. And that we need to be doing research both on the policies that can impact changing the kids' access to guns, as well as the other kinds of strategies that, in the absence of a big national change in where things are going with guns, in the meanwhile, what are the things that we can do within our homes and in our communities to keep guns out of the hands of kids? I know that that's probably a somewhat inadequate answer, but I don't know if others have other thoughts. But I think the research is very clear that we need to do that part, and there is research on various strategies to help decrease kids' access to guns.
Tom, do you want to speak to the raising awareness and
Sure.
apathy?
I think you make a great point about the level of apathy, and it's something that has troubled us for a long time in terms of, as I mentioned earlier, homicide's the second leading cause of death among children in the United States. And you would think, one would expect that there would be greater awareness about that fact, that there would be a clamor for increased action to address the problem of youth violence. And the sense that we have, and in talking with some of the communications experts that I've been able to consult with, the perception seems to be in the general public that it's somebody else's problem, that it's a problem that really needs to be contained in other communities, and we need to stay away from those communities, rather than a problem that all of us has a responsibility to address. And so that is a big part of what the Strive initiative is intending to do, is to raise awareness about the level of youth violence, about the consequences for youth, families, and communities. And those are consequences that we all experience in terms of fear and regarding where we go and what we do, but also in terms of economic costs associated with dealing with victimization. So raising awareness about the problem of youth violence, raising awareness that there are evidence-based strategies and that these strategies can be cost-effective in reducing the problem of violence is a big part of what we're trying to do.
Thank you, Tom. I see we have another question already.
Yes. Hi. One of the questions I have is, I've had the privilege of working with a lot of young parents, and my concern is both the mom and dads and the exposure to normalizing for their children their gang affiliation, that it's okay, and how that interplays with violence, because doing the little cute, representing of gangs, and then how it becomes a norm, because then violence also becomes part of the norm. And when parents are not together, how a mom maybe can change a perception that's, they see their little child aggressive, and, the father is supporting, don't let no one pick on you, or things like that, because that's the mindset. And, what kind of programs are out there so that you can help the parents to be educated that this is something that this child is being influenced, and then it becomes a norm, that it's supported by the parents, and they're not really realizing that it's not funny, it's not cute, because when they get into preschool, kindergarten, they're getting kicked out, because of their aggressive behavior.
Deb or Karen, one of you want to?
Well, I just want to comment. And I know there's at least one other provider here that I talked with earlier where we were able to benefit from having funded a particular grant to develop our Reaching Out to Help, we call it Reaching Out to Help initiative. And when we're talking about, our efforts around prevention on the primary prevention level, this is where all of the trainings that have been occurring, that we've been implementing in the schools and inviting the community partners and the families, well, this is where we begin to discuss those risk factors and really helping to educate that community as a whole around what those factors are. So raising the awareness and the conscious levels of the parents so that they can be more in tune with those signs if they're seeing those signs early on, and they can be communicating what those issues are early on versus later in the child's development. We also have a program, again, a special initiative that looks closer to the parents of children between the ages of 0 to 8. And so as they're becoming parents for the first time and still instilling them the notion of the importance of recognizing risk factors even at that level, to have that early education around that is critical to families really being able to respond to those kinds of behaviors that they see in their children. I hope I answered your question. It's a roundabout way of doing it.
I just want to add one point to that is that the other piece that you point out there is that you're talking to dads too and fathers. And men have often been left out of the work that we've been doing. Moms tend to be who we reach out to. They can sometimes be easier to gain access to. And it's really only recently that we've had, that we've really understood that dads matter. They matter in very important ways, and they matter in ways that are not just that they are male versions of mom, that there are specific things that dads bring to impact their kids' development, and that we need to think about, including dads, particularly young men who are becoming fathers, and trying to get them involved early on. So we're doing some very early kind of pilot work and trying to understand better father involvement in kids' lives and the relationship particularly between young parents and how that's related to kids' development, and then how do we bring men into prevention, because they've really been fairly absent.
Tom, do you want to add something before we take
I
another
just
question?
wanted to add one other piece. One of our collaborators in our Reaching Out to Help initiative is Circle of Parents, which is a national parenting network. And one of their particular initiatives that they have going now is a fatherhood initiative. So the whole notion of engaging the fathers and helping them to recognize the importance of good parenting. And through that initiative, we're benefiting as a partner to have some of that training coupled with the training that we're currently doing through our Reaching Out to Help initiative for fathers.
I just wanted to mention a couple of quick things too, that we're seeing increased recognition that gang suppression activities are not enough, that we need to focus on what can be done to reduce the likelihood that kids will join gangs in the first place. And I think that's part of what you're speaking to. And so we've actually entered into a collaboration with NIJ to bring together experts on gang violence and gangs in general to talk specifically about what can be done to reduce gang joining. And there's going to be a book coming out in the near future on that. It's a collaboration between CDC and NIJ. But we're also taking the blueprints programs that I mentioned earlier, those that have been rigorously evaluated, and we've got a group of experts who are calling through those to identify the specific programs that have the greatest potential to reduce gang joining and gang violence. And we're going to have a concerted effort to tailor those programs to maximize the likelihood of their being effective on gang joining and gang violence, and then evaluate those programs. So it's something that I think there's more momentum building around, and hopefully you'll see some new programs in the future.
We have several other questions, if we can get the mics.
That's on. I have a concern about the misuse of social resource. I think we probably have 20 or 30 different social resources here, and we tend to be competitive for scarce resources. We talk about collaboration across government, academia, and a social resource. We don't talk about collaboration across social resources. You have any advice? I mean, how do we better use the 1.3 million social service entities that exist out there?
Well, my response to that is, if we're not doing the collaboration as social service providers now, we're going to be doing it real soon. And because, you know, like you're saying, the funding is really getting, you know, few and far between in terms of the dollars at this point. We all just learned about some budget cuts that are coming down the line. So, but the importance of and the necessity of the services is still there. So how do we continue to be able to provide them with minimal resources? And the only answer to that is going to be a pooling of resources across providers.
Yeah, I was just going to add that, you know, from a public health perspective, a role that the public health department can often play is as a convener in bringing together representatives from multiple sectors, and that's going to be a part of what Strive is focusing on, trying to facilitate within communities, to take advantage of the limited resources that are available, to make decisions about how those resources can best be spent. So we're anticipating building the capacity of public health departments to serve that in that way.
I think we might have time for just one last question before we're asked to vacate the room. So if we can get a mic over to someone. Ann?
Considering that there is apathy, there is this whole concept of collaboration, as well as understanding that we have to be accountable, especially like the gentleman mentioned about social resource sharing. My big concern is that Strive is a great program. You've brought it to Chicago, whether it's through Shape and All or any of the community groups. There are a number of groups that are trying their best to put programs together. There is the whole concept of, if we go to researchers, we have to be accountable to do certain things. So by minimizing, because the staff cuts are so intense in social service, that you begin to say, by minimizing that, you're saying, I will be accountable for just this program. That makes it almost like a narrow thing rather than a comprehensive thing, which is all what you all are talking about, multi-sector, all kinds of multi-approaches. How does, there have been a number of approaches in Chicago that have brought groups together. How do you propose at this time, where you are going to 30 groups, to bring more groups to become intensely together and making it happen?
Yeah, yeah. So you're talking about, you know, that's difficult, and it's even more difficult now with the limited budgets, you know, in cities. We're seeing great success through Unity. I mentioned our urban networks increasing thriving youth effort out in California, you know, by the Prevention Institute. We're seeing great success within these Unity network cities of, you know, starting small and building from there, and bringing to the table the key representatives from these different sectors, and talking about what the common goal is, what they're currently implementing, what's working, what's not working, what does the evidence tell us about what else could be done, and then working together to try to move that forward. I mean, there's no simple solutions. It really does require coming to the table and talking through what are the available options and how can we move it forward together.
Thank you. I think we've run out of time this morning, although I still saw a number of hands, so I hope that we'll have the opportunity to continue the conversation in other ways. I want to thank those in the room and those who joined us by the webcast for participating in today's program. And most important, we want to thank you for your interest in children, the well-being of children and youth, families, and their communities. Have a good day, everybody.